Well, mental health and homelessness are major concerns for public safety in New York City. Recently released data from the Adams administration showed that the results of the mayor's involuntary removal policy, giving police the authority to take people having a mental health crisis directly to treatment. But the program's drawing criticism from some members of city council in a new report. According to the study, involuntary transports were 5 times more likely to occur from a private dwelling instead of a public space like the subway. More than 40% of people transported were not ultimately admitted for inpatient care. And then concerns over racial disparities. While Black New Yorkers make up around 23% of the city's population, they accounted for 54% of involuntary transports. Joining us now is CBS News law enforcement contributor and former deputy commissioner with the NYPD, Richard Esposito. Richard, welcome. Let's talk about the power this involuntary removal process gives officers. What can they do when there's someone having a mental health crisis and threatening public safety?
I think that's an important distinction, what the officers can do versus what the long-term care issues are. And the report, it's really a 4.5-page document, which cherry picks and has rather sloppy analysis, frankly, and doesn't really address the public concern. So the officers have been re-empowered. It's something they used to be able to do, to remove disruption from the subway. And they do it with a pretty light touch when they can. So that's what the cops can do. What the long-term issues are really outside the police areas of responsibility. Those are public health issues. And those things the report does, in fact, address in a clear way.
So the City Council report questions the effectiveness of the policy, saying that it threatens a person's autonomy. So without this policy, what are police able to do in a crisis situation?
The police, it's been in the past a real challenge for the police. And what this report ignores is the autonomy or the agency of the 5 million people who ride the subway every day. And it's just completely without context. The riders suffer from the disruption, and the homeless people or the unhoused people suffer from a lack of care. So what the police are doing is trying to address the concerns of the riders and bring the unhoused people to places they can get care.
Now, is this something that has worked in the past, or is this a relatively new way of tackling the homeless and mental health crisis in the city?
Now, Cindy, this comes under everything that's new was once done. What's old is new again. Police had these powers, not just for people who are unhoused, but for many people who are disruptive in public transport and public places, where now they've been really limited in the discretion of moving people along. And this is, I think, from my point of view, a good step, as long as it's done well. And I think in the main, we'll see it done well.
All right, CBS News law enforcement contributor Richard Esposito, thanks so much for joining us.
It's good to see you. Good morning.
You too. And Richard joins us every week. For more on this, head to our website, cbsnewyork.com.